Good day, ladies and gentlemen. My name is Anton Villanueva. I will be your moderator for part 1. Before we begin, just a few reminders. We have turned off the chat box, but you can ask your questions through the Q&A box. And for that, please direct it to a specific speaker or speakers. And if your question cannot be addressed this afternoon, then it will be included in our emailed responses post-conference. And just a disclaimer that our good expert speakers who present opinions during their presentations may not necessarily be the same official opinions of ERIA. Let us begin with the welcoming remarks from ERIA's Director General for Research and Policy Design Administration, Mr. Taizo Hara. Hara-san, please.
Okay, thank you, Anton-san, for your kind introduction. Good afternoon from Jakarta, Indonesia. We are pleased to welcome all speakers attendees from all over the region as well as globally. I understand some of the speakers are currently in the United States and Europe. This is the first regional conference on pandemic-based policy strategies, balancing health and economy, where we will listen to country experts share on how their governments within ASEAN and East Asia and our neighbors have responded to the health and economic issues posed by this COVID-19 pandemic, saving lives while saving the economy as well. Now, for over 2 years, the COVID-19 pandemic has challenged and transformed national and local health systems and battled all types of economics across the globe. Much COVID-19 focused medical research and development innovation alongside the preserving efforts of political leaders to safeguard and sustain economic progress has been undertaken. Within the diverse community of ERIA member states alone, which includes the 10 ASEAN, 3 East Asia, and 3 neighboring states, a variety of measures have been tested as attempts to balance each nation's health and economy. It has been said that sometimes the economy has been sacrificed, and at other times, health has been sacrificed. A first of this kind, this regional conference responds to requests heard through public regional meetings and collaborative organization for such a gathering to find a good balance of health and economy. Measures for each of us. In this way, we can become better aware of and consider untried option of perhaps more smoothly exit this pandemic as well as better prepare for coming ones. Experts have thus been invited to present their government's health policy strategy or to propose policy. This year's ASEAN Chair, Cambodia, will open the session, and then we will proceed to hear from 2 hard-hit ASEAN island nations, Indonesia and the Philippines, followed by Thailand in mainland Asia. Then after a short break, we will hear from neighbor India, and from East Asia, Japan. Our senior economist advisor will also speak and comment. Finally, we ERIA thank for all of you for your interest and effort in working together toward better understanding and to make our regional family and the world community a better place to live for all. Thank you very much.
Thank you, Director General. Let's next hear from Dr. Song Hyang Ai, Director of the Southeast Asian Ministers of Education Organization, Regional Center for Technical Education and Development. As Director General mentioned, he is representing Cambodia, which is this year's chair of the Association of Southeast Asian Nations. Dr. Song, the floor is yours.
Dear Mr. Taizo Hara, Director General of Research and Policy Design, ERIA, Excellencies, Professors, ladies and gentlemen, good afternoon. I hope you are doing well during this pandemic time. It is my great pleasure and honor to be with you all for today's first regional conference on sharing the pandemic best practices virtual. I would like to give my sincere thanks to ERIA management for allowing me to be here right now. I am proud to be uniting with you all at this important event. 2022 marked Cambodia's Asian Championship with the theme Asian Act, addressing challenges together. The pandemic severely affects human well-being, hindering the economic growth for the past 2 years. However, it is a good opportunity to transform economy and health system to more advanced and digitalized. Digital technology transform the way we work in a sophisticated way. I have no doubt that we will join hands to achieve it together, upholding unity, solidarity, and economic connectivity. Excellencies, professors, ladies and gentlemen, the regional conference will provide an opportunity for scholars and practitioners to share their best policy strategy in the most effective approach in exceeding the pandemic. There are a lot of research studies focusing on COVID-19 to explore trends and issues to balance human health and economic progress. How can we balance human health and economic growth in the Asian region? 3 experts from Indonesia, Philippines, and Thailand will answer this question. We will also learn the best policy practices from other countries such as India and Japan. Let me share some COVID-19 highlights in Cambodia as follows. Our Prime Minister Samdech Techo Hun Sen has launched our vaccination campaign, which has now extended to children of 3-year-old. Over 100% of our eligible population have been injected voluntarily with both basic and booster doses. Cambodia's effort to recover from COVID-19 underscore the larger need for ASEAN to have a framework for a care economy which focuses on social welfare. During a rapid outbreak, the royal government of Cambodia has issued a massive vaccination campaign to 2 provinces, Phnom Penh and Kandal, that had the most confirmed cases. Then the campaign gradually spread out to other provinces. To help support vulnerability families financially, the royal government provided a cash transfer program for them during the hard time. In addition, $75 was allocated for each infected person during a quarantine period. In the economic sector, care economy is an emerging trend for growing population consisting of baby care, patient care, elderly care, disability care, pregnancy care, and domestic care. Care economy is underappreciated around the world. Care work is important to sustain life. ILO projects the global employment in care job rising from 206 million jobs to 358 million jobs by 2030. Excellencies, Professor, ladies and gentlemen, the regional conference paved the way to share best practices in exceeding and being ready for a new pandemic. I hope that you will have great time to learn from our eminent experts. I wish the conference be productive and inclusive with a fruitful discussion. I encourage active interaction between speakers and participants for Q&A session for learning, sharing, and finding out balances between human health and economic during the pandemic disruption. Once again, I convey my sincere thanks and deep appreciation to ERIA management, eminent speakers, and participants for hosting and participating in today's forum. Please stay safe and healthy from the pandemic. I would like to officially open the first regional conference on sharing the best practices from now on. Thank you for your kind attention.
Thank you, Dr. Song, for that wonderful opening address. Next, let's hear from our first expert from Indonesia. He is the former Director of Communicable Diseases of WHO in Southeast Asia in the regional office here, and is currently Director of Postgraduate Studies at the University in Jakarta. At the moment in New York, let's hear from our esteemed expert, Professor Chandra Yoga Aditama.
Good afternoon, colleagues, ladies and gentlemen. First of all, I would like to thank the organizing committee for having me to discuss with all of us regarding the COVID pandemic, as well as the preparation for the coming pandemic, if there is should be happening in the future time. As we all know that before COVID-19, we already experienced the pandemic of influenza pandemic. It was on 2009, and this pandemic of H1N1 was declared by DG of WHO at that time, Dr. Margaret Chan, on 11 June of 2009. And then after 1 year and 2 or 3 months, on 10 of August 2010, WHO also already recommend that the H1N1 is in post-pandemic period. So the pandemic was already over for H1N1. We all know that WHO also already declared the COVID-19 as a pandemic, and we are looking forward for some days ahead that the WHO will also declare something like this, that the COVID-19 will also be over at that time. But when we realized about this H1N1 pandemic, even though it is already mentioned, it is in the post-pandemic period on 10 August of 2010, WHO mentioned 3 things that I think it is very important. The first thing that they said is, as we enter the post-pandemic period of H1N1, but the H1N1 virus it does not mean that the virus has gone away. The virus will continue to circulate for some years to come. So when later on COVID pandemic will also come into the post-pandemic period, the same will happen. The SARS-CoV-2, the virus that caused COVID, will still continue to circulate for some years to come. That's the first issue. The second statement that WHO mentioned on 2010 was that there will still be many questions, even though pandemic is already over of H1N1. The same will be for COVID-19 as well. If the pandemic of COVID-19 already over, there will still be many questions to be answered. And the third one is the most important part is WHO mentioned clearly that even though pandemic of H1N1 was already in the post-pandemic period, but continued vigilance is extremely important. This will be the same topic, this will be the same important issue if COVID pandemic will be also over when there is a time for that one already. So continued vigilance is extremely important. After the H1N1 pandemic was over, then based on the international health regulation, WHO has to establish a review committee. I was the member of the review committee at that time that we try to see what is the global response of the pandemic H1N1, and our report saying that based on the H1N1 pandemic, that the world is ill prepared for health emergency. So my team recommendation was declared on 2011. So after 2011, I mean 2012, 13, 14, globally trying to prepare better for the coming pandemic after this one, because it's already mentioned the world is ill prepared. But as we know, then the COVID pandemic then arise. On 11 of March 2020, the DG of WHO, this time Dr. Tedros, mentioned that COVID-19 can be characteristic as pandemic. And when H1N1 was over, review committee was established in terms of COVID-19. Still during COVID-19 is in pandemic, then WHO already established a kind of committee, but they call it here now the Independent Panel for Pandemic Preparedness and Response. And they are learning what the world do during the COVID pandemic, and their statement was, it is painfully aware that the world was not prepared. What I'm trying to say is, on 2011, my committee is saying that world is still prepared, and 10 years after that, on 2010, or another committee saying the same thing. It is painfully aware that the world was not prepared. None of us would be hoping 10 years after now, or even 20 years after now, there will be another committee saying the same thing. So we have to be prepared. We have to make a good preparation for the possibility of the coming pandemic. Before talking about the coming pandemic, you know, publication of WHO just a few, last month, talking about how to end the emergency of global COVID-19 into 2022. Not ending the pandemic, but ending the global emergency. They're talking about 5 areas: vaccination, public health and social measure, engaged communities, clinical care and resilient health system, research and development, surveillance laboratories, and the COVID preparedness and response and coordination. So these 5 should be done this year to be able to control the situation, control the emergency situation of COVID-19. But of course, even though COVID-19 can and will be, you know, taken care of by all of us, but there will be another pandemic in the coming time. So Dr. Tedros mentioning, we know for certain there will be future novel virus of another so-called disease X. People might also say COVID-19 was a disease X, but the next, there will be another disease X out there, whether it is global influenza, whether it is zoonosis, etc. So how could we prepare for this coming next pandemic? The independent panel of the one that I mentioned clearly mentioned a global reset is needed. The Indonesian president, Joko Widodo, is saying that the G20 countries, as you know, this year Indonesia hold the presidency of G20. There is a need, the role of G20 of building global health architecture. I myself wrote in one of the newspapers in Indonesia regarding restructuring of global health. So what are these area of this one? If you are talking of the global reset from the independent panel, they are mentioning about 8 things. Number 1, elevate leadership to the highest level, and then focus on strengthening independence of WHO, invest in preparedness to create fully functional capacity of national, regional, and global level, international system of surveillance, validation, and alert, pre-negotiated platform for tools and supply, and raise international financial model for the global public good and for pandemic preparedness and response. And for country level, countries should establish the highest level national coordination for pandemic preparedness and response. So I will share some of Indonesian experience in this regard. Sorry, this is in Indonesian language, but just I will just go with you this organization structure. So firstly, the Indonesian COVID-19 was taking care of this one. This is a national task force on COVID-19. This one only taking care of health aspect of COVID-19. But later on, the Indonesian president, Mr. Joko Widodo, he established a national committee of COVID-19 control and recovery of national economy. So 2 in 1. We could control the COVID-19 and economic should be recovered as well. So this committee includes so many ministers here that taking care both of this issue. And several days ago, the Indonesian president said that public health and social measures of Indonesia will continue until COVID is 100% under control. So COVID as well as economic situation. So their report usually cover 3 things. What is the vaccination COVID vaccination coverage for the country? How is the health situation? And how is the economic recovery of the country during the pandemic? So this 3 in 1 going together in one go. So I think this is one way of trying to make a link, not make a link, to handle COVID as well as to recover economy as well. Just to share with you some data of vaccination. You know, these are countries with 100 million or even billion population: China, India, US, Indonesia, and Russia. And these are another ASEAN countries, colleague. If you are talking about number of people already this complete initial COVID vaccination, so China number 1 because the population is big, India, US, Indonesia is here. But if we share the ratio between number of vaccinated compared the number of population, so the global average is 59.4. Almost all ASEAN countries above this global global implementation of vaccination coverage. And this is the Indonesian situation of COVID-19, the blue one, as you can see, the highest peak was during Delta variant, and then going down and then going up again due to Omicron. But the peak is not as high, it's a little bit higher than Delta, but not as high as the global. So this is the global situation. These are the Delta, and the Omicron, as we all know, is very high. But now globally, as well as Indonesia, as well as most ASEAN countries, now number of cases are could be say under control. So my last slide will be, how can we imagine the global health in the post-pandemic period? These are some of things that should be important. Number one, we also realize that emergency program, national level, global level, should be centralized. The healthy lifestyle, what we call new normal now, should be a now normal. The promotive preventive action should be a very important part of health program in line with curative and rehabilitative. All health programs should have a community ownership. Universal health coverage is one of the priority of public health problem globally as well as ASEAN country. And then, even though we are talking about global or we are talking about public health, but patient center and people center should always be maintained. And the health problem should include or be a part of the new industry 4.0 or 5.0 or even later on something. And I just would like to remind that the SDG target of health and well-being should be reached on 8 years from now, and it really need a extra effort for that one, including the new issue of climate change and One Health to taking care of some problem of climate change or zoonotic animal sector. Ladies and gentlemen, dear colleagues, thank you very much. And from Indonesia, terima kasih.
Thank you, Professor Chandra, for that expert national as well as regional advice. And we hope you keep safe and healthy in New York. Next, we'd like to hear from a key opinion leader, the Honorable Undersecretary of Health, the Department of Health of the Philippines, Dr. Maria Rosario Singh Vergere, joining us from the Department of Health, Manila. Yusek Vergere, please take the floor.
Thank you. Thank you very much. Good afternoon to all of you. Mr. Taizo Hara, Dr. Takuma Kato, Dr. Seonghang Hai, and all of my co-panelists. Good afternoon, and to all the participants of this forum. So let me begin with a brief COVID-19 situation in our country, the Philippines. Looking back, as seen in this graph, we experienced the fastest and largest increase in our COVID-19 cases in January of 2022, which was primarily caused by the local transmission of the Omicron variant. Despite this, the rise in cases we experienced due to Omicron was also the fastest to decline compared to the prior variants. With regard to hospital admissions and severe and critical cases, our peak was recorded back in September of 2021 when we were dealing with the Delta variant. Despite the large increase in the recorded cases in the most recent Omicron spike, hospital admissions remain below than that of Delta. Currently, we see that the reported cases continue to decline. On the week of May 10 to 16 of this year, we reported an average of 157 cases per day, which is below the lowest reported average prior to the Omicron peak at 254 cases per day last December of 2021. As cases continue to decrease and as hospital admissions plateau, our healthcare utilization rates remain to be at low risk, with national total bed and ICU bed utilization rates at 16 to 17%. Looking at the severity of admitted COVID-19 patients, around 11% are severe and critical, while majority have mild or moderate cases, making up about 69% of our admissions. I will now share with all of you the strategies and practices that our country has applied for in this pandemic. Recognizing that defeating COVID-19 necessitates a response continuum, we have adopted the prevent, detect, isolate, treat, and reintegrate strategy which remains to be the cornerstone of our national COVID-19 response. We have also integrated the National COVID-19 Vaccine Deployment Program in the PDITR strategy, because immunization is one of the most essential public health interventions to defeat a pandemic, and we made sure that we maximize our efforts in integrating them to universal healthcare reforms. The PDITR is embedded in the four-door strategy, which provides the framework for the National Emergency Operational Response Plan in the prevention and control of emerging infectious diseases, in this case, the COVID-19. Allow me to run down our strategy and how it served as our guide in all of our different policies. Starting with prevent, the BIDA solution has been the core of our efforts in encouraging adherence to our minimum public health standards. As an offshoot of the BIDA solution campaign, the Res Bakuna Kasangga ng BIDA campaign was also launched almost a year ago, when we began our demand generation and communication efforts for our national COVID-19 vaccination drive. Our BIDA Solution campaign received a Bronze Award for the Communications or PR Campaign of the Year from the Stevie Awards and the Silver Marketing Excellence Awards in 2021. And our Res Bakuna campaign received the highly coveted Anvil Award, which is awarded to outstanding public relations programs and campaigns in the country, and also the Silver Award for the best PR programs. As a result, the positive effect brought about by these efforts, especially the vaccination operation, can be seen in this graph. As the vaccination coverage increases, which is the green line, the severe and critical admissions also decreased, which is the orange line. A decrease in the number of severe and critical admissions would be beneficial in decreasing the healthcare cost associated. Next, under Detect, we have enhanced our surveillance capacity by initiating the digital transformation. We did this by using the electronic case investigation forms, cloud-powered data management and analytics, and the use of disease models. To ensure that we improve detection of variants of concern and its sublineages, variants of interest, and those under monitoring, we continue to provide support to the expansion and capacity building of sequencing facilities in our country. The Philippines is the 5th among ASEAN countries as to the number of sample sequences submitted to GSAID, a global data sharing platform. Functional epidemiology and surveillance units were vital in our Detect strategy. As of April 2022, all 17 regional epidemiology and surveillance units, or RESU, as we call them, are now functional. Moreover, a strong laboratory network was equally important to complement our surveillance capacities. From only having just 17 COVID-19 testing laboratories back in April of 2020 that could only conduct around 3,000 tests per day, we now have a total of 334 testing laboratories which are able to run more than 20,000 tests per day. During the COVID-19 spike, the network was able to conduct as much as 90,000 tests per day. From the beginning of the pandemic, we have tested more than 29.5 million samples for SARS-CoV-2 confirmation. It is also of importance to make testing accessible to the public. Through the executive order coming from the Office of the President of the Philippines and a joint administrative order, we implemented a price cap to COVID-19 testing that are based from costing and pricing data from consultations with different stakeholders. This allowed us to rationalize reduction of the price cap for the different test kits. Meanwhile, expansion of the whole genome sequencing sites is a cornerstone of our biosurveillance activities and strategies. As of April 26, 2022, we have sequenced a total of 32,700 samples. We started this endeavor with only just one laboratory in January of 2021, when we were only capable of testing 750 sequences per week. We have expanded now to 4 laboratories, our UP Philippine Genome Center in Diliman or National Capital Region, 1 in Visayas and 1 in Mindanao, and the Research Institute for Tropical Medicine, which can already sequence almost 1,500 samples weekly. As we move towards the endemic scenario, we will also be transitioning on how we monitor and give directions on healthcare system capacity. From the pandemic scenario, which requires COVID-dedicated beds in all of our hospitals, we will shift into the transition phase where only selected hospitals will be required to dedicate beds for COVID. This shift can also help reduce the additional cost associated with having a separate dedicated bed for our COVID-19 patients. In the future, we are looking at COVID-19 beds no longer being required in all of our healthcare facilities. All hospitals should then invest and make sure to have infectious disease treatment capacity, possibly in the form of dedicated wards, and to continually implement infection prevention and control measures in their operations. In ensuring appropriate care is available in communities, home care is now an integral part of the whole model of care frame for any disease, promoting its use so as not to burden our healthcare system capacity and to empower individuals and families in managing cases. We have promoted community-level access of self-administered antigen tests, and drugs for mild to moderate non-hospitalized patients are also being democratized for community access, empowering families to do immediate action and isolate in the peak of our Omicron transmission. Lastly, COVID-19 vaccines are now available to most of the population. Through a whole of government, whole of society approach, the National Deployment and Vaccination Program for COVID-19 vaccines has provided the needed protection against COVID-19 to most of the population groups, including primary doses for adults and children and boosters for indicated priority groups. Future directions of the vaccination program move toward the integration of our existing efforts into the national immunization program and include routine immunization, which will also expand to immunization programs for all life stages. To end, and on behalf of the Ministry of Health of the Philippines, I would like to express my gratitude for giving us this platform to share our country's COVID-19 experience and response. Again, to continue our overall prevent, detect, isolate, treat, and reintegrate strategy and ensure that the gains of our health system, what we've had during this pandemic, we need more long-term investments and sustainable partnerships from our ASEAN neighbors. We hope to continue and strengthen our global partnerships for all for the benefit of our countrymen. Thank you very much and good afternoon to all of you.
Thank you very much, Yusek. It is good to hear that the Philippines' best policy strategies and practices have become effective now. And we are very happy to hear that quarantines are no longer required in the Philippines and like in Indonesia. Next, rounding up today's medical experts from ASEAN is Professor Prasit Watanapa. He is the Honorable Dean of the Faculty of Medicine Siriraj Hospital of Thailand's premier public national university, Mahidol, in Bangkok. And the good dean is currently in France attending a convention. Dean Professor Prasit, please take the floor.
Good afternoon, everyone. I would like to thank the organizing committee and the ERIA allowing me to come and share the Thailand experience, how we manage the COVID-19, particularly how we balance between the health and the economy. I would like to start with the timeline of what happened in Thailand. The first case of COVID-19 was diagnosed in early January 2020. And in March, the government decided to establish the CCSA, the so-called Center of COVID-19 Situation Administration, chaired by the Prime Minister. The main components of the CCSA include the authority, which means the Prime Minister, the Minister of Public Health, the Head of Department of Disease and Control, the Minister of Interior, Minister of Foreign Affairs, and also the Governor of Bangkok. The academician, which include health, and also economy. There were people from the several universities and also the Ministry of Public Health regarding the health issue, and also the Ministry of Finance regarding the economy. The third main component of CCSA is a representative from major public organization and big private company. This is how we work. There are 3 levels of committees. The first level focus on health. This committee was called the Emergency Operations Center, or EOC, of Ministry of Public Health. There are 2 groups of participants. The first one is people from the Ministry of Public Health. Another group was the Dean of the Medical School and also experts in several areas in biology in the medical schools. We work together. The EOC will monitor the situation not only in Thailand but also worldwide, review our research work regarding the COVID-19 and also the vaccine. And we update the situation to the second level of committee called the Operating Center of CCSA, which the main component include the administrative team of the government and also the government consultants. The government consultants in this second level of committee include those who are business people and also those who are medical people. Some suggestion from the EOC regarding health will be pushed forward to this second level of committee. And then after discussion with the consultants, they will try to start to look at how they can balance between health and the business, and then put forward the suggestion to the top level of the committee or the CCSA, which include the administration and also business and also the health and science people. In general, the government policy or priority management, we set up health as the first priority, followed by economy and then the public and society. We treat health, the combination of health, economy, public, and society as a national security. During the ascending phase or the active outbreak of the infection, obviously health was the first priority. But then if we can control the outbreak, move toward the so-called descending phase of each outbreak, the government will start some initiative and gradually implement several relief measurements to improve the economy and to relieve tension of the public, while asking people to maintain universal prevention of the pandemic. When I say universal prevention, I mean using the face mask, doing physical distancing, and cleansing, avoid going into the area with crowded people. All measurements will be evaluated every 2 to 4 weeks at the first instance, and then extend to 4 to 6 weeks later on. As I mentioned, balancing between economy and health will be done in the second level of committee. This is the most recent graph showing you the situation of COVID-19 in Thailand just only a couple of days ago. If you look at this Delta wave and also the Omicron wave, which represent the third and the fourth wave, you cannot see the first wave obviously because there are not so many infected people at that time. So I would like to separate the graph into those in the first wave that in 2020 and those who are in the second wave at the beginning of the second wave that is late 2020. Let's focus on the first wave, what the government did at that time. The first case was in early January, on the 12th of January, and then early March, there's a rapid increase in new cases diagnosed each day. The government decided to declare the state of emergency on March 26th and use the lockdown measures. And then a week later, curfew was implemented. And also on April the 4th, suspend all commercial international flights. The government did quite well. Thailand can manage and control the outbreak of infection. And then on May the 3rd, just only just over 1 month later, the government started the relief measurements, which were classified into 6 phases. Each phase will allow some social activities to take place. And then if the result turn to be positive, I mean, there's no increase in number of new cases, we extend, provide more and more social activities, and then move the second phase. Each phase spend about 2 weeks time for evaluation. And then if you can see here, at the end of the first phase, there comes the second phase, which means by the end of 2020, during November, there start the second wave. But now instead of infected by the Wuhan variant, people was infected by the Alpha variant. And then in the second phase, the government did not use the lockdown strategies. We did quite well during the first wave, and we were quite certain at that time, even the second wave, we should be able to control it. So the government decided just only to slow down some social activities, not a lockdown. There are some areas with a big cluster of infection, we can shut down some activities, but only in those areas. For economic recovery, the government clearly focused on helping vulnerable people while maintaining the health of the Thai economy through supporting businesses and creating jobs. That's the principle. For the key strategy that lead to economy recovery was to persuade, to recommend, and to push forward Thai people, particularly the high-risk population, to have adequate vaccination. We start the vaccination in late February 2021. For the relief measurements, includes several activities or strategies. The first strategy is to gradual easing of restriction of social activities. We allow some outdoor activities and then move toward the semi-outdoor activities. And if the situation still maintained in the good direction, we move toward the indoor activities. Food delivery was allowed, and then move toward the clean garden, which usually open space, and also the restaurant, which is a closed space, evaluate every 4 to 6 weeks. For financial reparation, for financial support, the so-called the COVID-19 financial relief program, the government start the financial reparation, giving people to those who are labeled as low-income people to make sure that they have some money to spend in order to support themselves and also their families. The half and half co-payment scheme, this is quite popular, and I have to say this is one of the most successful schemes used by the government during this COVID-19. In principle, people who are registered in this scheme, they can go to buy food by paying just only 50% of the cost, and the government will subsidize the remaining 50%. This scheme simultaneously aids people in need with meals and stimulated small business economy by subsidizing 50% of the payments to independent food shops. It's so successful that we are now running the fourth phase, which started March a couple of months ago. Soft loan facility for business. The government set up the total budget of 250 billion baht, which means about just over 7,000 million US dollars to support viable small and medium enterprise affected by this COVID-19 pandemic. Also, the debt reconstructing through asset warehousing with buyback options. The total budget was set up to be about 100 billion baht. The compensation benefit scheme for employees and employers. In fact, there are other strategies as well, but I have no time to mention all of them. This is my last slide just to show you how Thailand coped with the COVID-19, because by working together, we balance between the health issue, the economy, and also the public and society. And the three main players, the government who set up policy and all measures, the business operator who conduct all the activities to run the economy of the country. They have to follow the regulations, and also their customer who have to follow the regulation as well. Use the face mask, use the hand cleansing and physical distancing. I have to say that Thailand can manage the COVID-19 quite well, because by working together, the three groups, the government group, the business operator, and the business represents, and keep balance between the health economy and the public and society. So far, I think we have done quite a good job, but still a long way to go. We expect the COVID-19 to be endemic within 2 months from now. Hopefully, we will be successful in doing that. Thank you for your attention, and I'm willing to answer any question if they're going to be, and also would like to learn from the experience from other countries as well. Thank you for your attention.
Thank you, Dean, for that comprehensive presentation. And we'd like to thank all speakers again and for their presentations, their expert opinions. And we do have questions for you already coming in. We look forward to hearing more from your expert opinion shortly in part 2. We'll have a short break. It's now 2:49 in Jakarta. We will resume at 2:55. So everyone, please return after 6 minutes.
Hello everyone, thank you for joining in our conference today. And from now, part 2 is starting. I am Maskana Gattani, a senior policy officer of healthcare unit in ERIA. In part 1 session, ASEAN Member States policies for COVID-19 were discussed from Indonesia, the Philippines, and Thailand. These 3 countries' policies differ from each other. However, the attitude towards in search of the best way to control the pandemic, not only health-wise, but also economically, was common. In this part, I'd like to invite distinguished speakers from India and Japan. At first, we have expert opinions from Dr. B.J. Murali, COVID-19 Task Force and Minister of Health, India. Also, he is a recipient of the Best in COVID Management Award in India. As we know, India has over 1 billion population and the second most populous country in the world. Dr. BJ will provide us how Indian government succeeded in promoting vaccine policies and in managing health sectors. And second presentation is from Dr. Nolia O'Malley, head of COVID-19 Task Force and director of Disease Control and Prevention Center, National Center for Global Health and Medicine, Tokyo, Japan. He is also the member of advisory board in Tokyo ICDC. Today, he will present a unique Japanese policy for infectious disease as one of the advanced countries in East Asia Summit states. Finally, Dr. Aladdin Leo, Senior Economic Advisor of ERIA, will wrap up the development of ASEAN Comprehensive Recovery Framework in the view of economic tolerance. After the part 2 session, we have the time to reserve questioning and answering for this seminar. If you have any questions, please don't hesitate to comment through Q&A box. Now, let me hand it over to Dr. BJ. Dr. BJ, is it okay? So please, over to you.
Thank you. Good afternoon, all. Greetings to all. I am very glad to introduce myself. I am Vijay Murli, COVID Task Force member from India. For the time consumption, I am rapidly invading into the topic. As you know, from this COVID, I am here to share my screen.
Yes, finally we can.
I got it. Sorry for the delay. These are all the questions, as you see here. These are all the questions arising during the pandemic time of India. I am here to try answer for these questions. First of all, what was the economical impact of COVID-19 in our country? As you know, our Indian economy is the 5th largest economy while comparing in the nominal GDP, and it is also the 3rd largest economy while comparing in the purchasing power parity. Indian economy was an emerging tiger before COVID, and it became a weakened coat after COVID. Our government taking a number of steps to recover this economical slump. That way, our government announced projects to increase credit supply and expanding employment guarantee to the urban areas may facilitate economic revival. On the control of, while speaking the control of pandemic panic in our country, government took 2 strategies to control the COVID spread. One was before vaccination, we tried to treat the patients by separating them by triage centers. After invention of the vaccinations, we started a mega vaccination campaign to control the pandemic. At first wave of COVID, the important strategy to control COVID pandemic was mega vaccination drive. In our country, India began vaccination program in January 2021. On that time, we had 3 approved vaccines in our hand. One was Oxford AstraZeneca, the second was Covaxin, and the third one is Sputnik from Russia. Among these, Covaxin is an Indian indigenous COVID vaccine, which ensured adequate vaccine supply. It fulfilled our demand. The vaccination policy on pandemic control, as you see, we have been given almost 73% of the population to have the first dose of vaccine. In the population, there are 63% population were fully vaccinated, and also we gave 2.1% of the people at least the booster dose. The successful story of our vaccination is this digital platform of vaccination. The Indian government required an end-to-end solution that captured each step of vaccination process to optimize utilization and maximize efficacy and ensure each person had access to COVID-19 vaccine. Our Prime Minister Narendra Modi launched the COVID-19 Vaccine Intelligence Network, that is called COVIN, on January 2021 to achieve this goal. This COVIN vaccine application played a major role to control the management the COVID vaccination program. COVIN now serves as an open source, and it is a multilingual application ecosystem that allows administrators to manage and update vaccine status along with inventory database, while enabling recipients to book vaccine appointments themselves. As you know, this platform, COVID platform, is a modular and interoperable, and it is portable, and it is also user-friendly proof of vaccination to the people. India's vaccination program was rolled out in a phased manner. We have 3-phased manner, where the first phase focused on vaccinating healthcare workers and frontline workers. The phase 2 focused on vaccinating people aged 45 and above. And the third phase, we focused on the vaccinating people aged 18 years and above in that category. In that way, in January 2022, India started vaccinating people's ages above 15 years and older, and began administrating precaution doses to healthcare workers, frontline workers, and people's ages above 60 years and older. As you speaking about COVID, COVID has 5 independent modules. They are, first one is the orchestration model, the cold chain model, the citizen registration model, the vaccinator, and the feedback model. On the other hand, it provides real-time dashboard of the COVID vaccination census. COVID application also provides functions, independent functions of these modules, which these modules are having independent functions, which minimizes dependencies across the modules, and it makes it easier to fix technical issues. At the same time, each module feeds information to the next one, which minimizes the user labor. COVID team currently exploring integration with blood bank management, routine immunization, and organ donation services. Within a short period of time, COVID has created an end-to-end ecosystem that integrates everyone from manufacturers to healthcare workers providing vaccines. The COVID team is currently exploring integration with these blood bank systems and other systems. On the other hand, we faced the challenges on management of COVID, non-COVID patients in the treatment sector. Here I am sharing the experience from a small southern Indian district of my jurisdiction. This is the map of my jurisdictional district, which was called Namakkal district from southern India. What are the problems arised in the health sector are challenges in the separation of COVID and non-COVID patients was a major issue to control pandemic. To control this crowd, we arranged a triage centers for every million population. In the triage centers, they offered patients screened and directed to facilities according to their symptoms, that the sudden burst in the outpatient census was reduced. This triage protocol, this what are you seeing is the triage protocol we are using till now. From this pandemic spread, pandemic management, what we have learned is an establishment of an hospital core COVID control facility with regular meeting is essential, and the integration of various resources and their coordination with flexible hospital infrastructure, continuous supply of medicines, and interrupted logistic service is very essential to manage this pandemic now and then. We should assume social responsibility of full health education among the population. And finally, a smart leadership with teamwork are very essential to manage this type of pandemic panic. On conclusion, we came to a decision that digitalization of mass vaccination program is very useful, and it gave us an upper hand to manage the pandemic. Screening and triage of patients reduces burden over healthcare facility. The growth of interdisciplinary approaches with traditional and new scientific collaborations should be concentrated. Every day, every post gave us a new challenges. That challenges should be converted to opportunities. I would like to thank Mr. Antonio, the Senior Advisor, and Koichi Hachiyama, Chief Operating Officer, and concerned technical staffs of ERIA for giving me this opportunity to express my experience over the pandemic management. Thank you all.
Thank you very much. Thank you for the extremely interesting presentation, Doctor. So we were looking at the key points of Indian healthcare policies. And interdisciplinary approach of traditional way and new technologies are an essential and effective element for controlling infectious disease. Thank you. Moving on, next speaker is Dr. Omar Ali. He is the head of COVID-19 Task Force and director of Disease Control and Prevention Center, National Center for Global Health and Medicine, Japan. Please, Dr. Omar Ali, over to you.
So my name is Norio Magali from National Center for Global Health and Medicine. Basically, I'm an infectious disease specialist. So that means that I'm taking care of the patient directly in the hospital. First of all, I'd like to thank all the organizers to let me have this kind of the place for the presentation. Today, I'd like to talk about the response to COVID-19 in Japan now and for the future, especially on the view of the how we can balance the economic activity and also infection prevention control measures against COVID-19. And to talk about it, I'd like to introduce some special point of infection prevention control and the social system here in our country in terms of the response to COVID-19. And the first of all, the law of Japan, the government of Japan can do quite little to restrict the private rights of the citizens to control infections. So the implementation of infection control measures in society heavily depends on the government's request for recommendation. Just request, this is not obligation, just request for recommendation, and the extent to which the citizens voluntarily comply with those recommendations. So what happened in reality? The compliance with IPC measures, infection prevention control measures at the individual level is quite high, and infection control measures by all entities are also slow, and the compliance is quite high. However, on the other hand, the sales in general, I mean the economy in general, have declined significantly in our country as well, particularly among entities that conduct interpersonal business, such as restaurants, and also in the travel and tourism industry, especially. So the economic impact on the people underserved is also significant. The negative effect on the mental health of the citizens and on the mental and the physical development of their children have been also pointed out. So as I mentioned, so basically my point is, risk communication is quite important in our country in terms of the implementation of IPC on the citizen level. And I'd like to introduce one quite interesting article that came from the Tokyo University. So basically their result is as follows, the government's requests are responsible for about only 1/4 of the decrease in outings in Tokyo, going out in Tokyo, while the remaining 3/4 are the result of citizens obtaining new information through government announcements and the daily release of the number of the infections. So now it's quite obvious in our country, and we are quite aware that the people are quite keen about the information of how the infection, how the trend of COVID-19 is going. And they are quite keen about obtaining information from government and all the media. And if they know that it's quite risky to go out, it's quite risky time for in terms of the catching COVID-19, they just do not go out. And actually, it worked quite well in our country. So again, it's quite important in our country to do a quite effective risk communication. Firstly, because the people are quite depending on those information, and the second reason is because the government do not have quite strong way or the strong way to control the people. So that's why actually the compliance of infection prevention control measures in our country is quite high. In the right side photo, I'm showing the wearing the surgical mask, and actually I have done a quite small study, and it shows that the compliance of the general citizen to wearing a mask is quite high inside, outside of the buildings. On the left side level, I'm showing the 3C, 3C posters. And now the based on the epidemiological study early in the phase of the pandemic of COVID-19, we in our country found that 3C is quite dangerous in terms of the acquiring COVID-19, which means that avoiding close contact setting, this is first C, and the second one is avoiding crowded places, this is second C, and the third C is avoid closed spaces. And now we know that many citizens in the country knows that compliance with avoiding 3C is quite important in terms of the preventing infection of the COVID, preventing ourselves from keeping away from the infection with the COVID-19. So I'm now in the last part of my presentation. So I'd like to talk about how we can balance the economic activity and also infection prevention control measures in our country. And this is one assumption we have to really think about. In Japan, the citizens and the society's expectations for minimizing the number of the people requiring hospitalization and also minimizing the number of deaths are quite high. This is the top priority in our country. So if we make a decision to how we can go to the next step, we have to really keep these sentences in mind. So based on this, prerequisite, I'd like to, this is not my recommendation, this is my idea in terms of the how we, where we go in terms of the post-COVID era. And I really believe that we, the Japanese society must become quite resilient against COVID-19. First, minimizing the number of the people requiring hospitalization, and this is quite important in our country. This is a top priority. And at the same time, we are also aware that the importance of economy. I mean, economic activity must be stimulated as soon as possible in the country as well. In Japan, the percentage of previously infected persons in the population is quite low. So that means, therefore, if infection control measures are relaxed or lifted at once, it will certainly result in a large number of hospitalization and deaths. This is something that the society and the citizens never want. At the same time, there are key points in IPC measures. So citizens are quite well aware of this. So it's quite necessary to restore economic activity while taking to the point, not just robust one, but taking to the point infection prevention control measures is quite important. It is also quite necessary to further improve the proper dissemination of vaccines, increasing vaccination rates, and also improving access to medical care, including drugs. If you have a capacity in terms of the medical care or healthcare, we can probably, tolerate a significant large number of new infected patients over the COVID-19. Okay, so this is my point for the today's presentation. Thank you very much for taking the time for listening to my presentation. Thank you so much.
Thank you very much for sharing Japanese main strategies on infection diseases. Japanese voluntarily lockdown and citizens' behaviors for preventions are very interesting characteristics. Thank you for the analysis and raising challenges for the future society, Dr. Magali-san. It's now honor to turn the floor over to Dr. Lee Law. He is a senior economic advisor of ERIA. He worked at the ASEAN Secretariat for many years, and the latest position was the Deputy Secretary General for the ASEAN Economic Community, during which he provided the overall leadership in the implementation of the AEC Blueprint 2025 and ASEAN's economic integration agenda. Now, we'd like to gain an insight into development ASEAN recovery framework in terms of economic issues from him. Dr. Lilo, floor is yours.
Thank you very much for a very kind introduction. And good afternoon to everyone, or good morning, or to other participants from other countries. I'm very pleased to be part of this conference, and I would like to thank the organizers for inviting me. Indeed, my pleasure to be part of this event. My presentation this afternoon is, I think, a bit different from the earlier presentations, in a sense that I will be providing a regional perspective on the issue of balancing between health and economy during this pandemic, particularly by highlighting the case of ASEAN, or the Association of Southeast Asian Countries. I'm not a medical doctor. I'm an economist by training. Therefore, my presentation will be very much biased on providing some economic analysis of the relationship between the economy and health sector, particularly on how the strengthening of that relationship, in my view, can be very critical in facilitating the post-pandemic recovery. Okay, let me, if we can, I don't know, it's not moving here. Okay, can I ask the assistance from our colleagues from ERIA to move to the next slide, please?
Yeah.
Yeah, I don't know what's happening here. It's not working from my side.
Okay, so we will click your slide. Wait a moment, please.
Yeah. Let me try to.
For the attendees, so please wait a moment to prepare.
Yeah, sorry about that.
slide.
Yeah.
Thank you for your patience. The PowerPoint is opening.
Yeah.
So.
Yeah, I think we're there. Yeah. Then if we can go to the next slide, please. Yeah, thank you. I think we all recognize that it's already more than 2 years into this pandemic crisis. But it is also very clear to all of us that COVID-19 is not only a global health crisis. It is more than anything else, the way I see it, a global economic crisis. Unlike the previous crisis, for example, the Asian financial crisis of 1997, or the global financial crisis of 2008, COVID-19 pandemic crisis, in my view, is more challenging in a sense that it affects not only the human capacity across countries in the world, but at the same time, it also creates some kind of disruption on the productive capacity of the economy. I think this explains why the shocks emanating from the COVID-19 pandemic crisis, in my view, will be much deeper and perhaps also longer. And I think it is very much evident currently, for example, that many countries around the world are still struggling to mitigate the impact of the COVID-19 pandemic on their individual economy. At the same time, if you look at the screen here, in the case of ASEAN, because of COVID-19 pandemic, the region contracted for the first time in 1998. And also there are huge losses being generated in terms of income loss as a result of higher unemployment. The latest estimate was around $100 billion for the region. And also, not to mention the other adverse impacts of the pandemic in terms of trade and investment in our region. And also, as I mentioned earlier, the adverse impact on unemployment. Around 6.7 million people were actually rendered unemployed by this pandemic. If you look at what's really happening in the region, I think even though economic recovery in ASEAN has started to pick up in the last quarter of last year. And even though social dislocations have actually started to gradually ease, I think the reality is that the recovery from this pandemic is actually very difficult to predict with because of a lot of uncertainties. Because in my view, the post-pandemic recovery will definitely depend on how the current pandemic is going to play out and how it's going to impact on the potential growth of the global economy, which in a way will also impact on the growth rates of other countries as well as other regions like ASEAN. So that in that basis, the ability therefore to manage or to balance health and economy during this pandemic is indeed very critical if we want a more sustainable post-pandemic recovery. Next slide, please. Can we go to the next slide? Yeah. So what's happening in ASEAN? I think when we look at ASEAN as a region, ASEAN was indeed fortunate to have acted decisively and quickly by developing a comprehensive approach in terms of mitigating the impacts of the pandemic. And at the same time, one thing that we can talk about the ASEAN recovery approach in ASEAN is that it is very much coordinated, meaning that the coordinated response in the region is very much evident in a sense that since the outbreak of the pandemic in early 2020, various regional initiatives have actually been implemented from trade, health, finance, social security, and other relevant sectors. And as a result of that, the idea is to make sure that through greater coordination, the region will be able to mitigate more effectively the adverse impacts of the COVID-19 pandemic. And I think that is very much reflected in the ASEAN Comprehensive Recovery Framework that was mentioned earlier. Under the ASEAN Comprehensive Recovery Framework, which is the slide that you have now on the screen, both health and economic measures are highly interrelated in a sense that they are given equal importance in terms of how they can be implemented to secure the recovery in the region. Aside from other measures such as the need to strengthen human security, accelerate digitalization, and advancing sustainability across many dimensions in the region. I think what I'm saying here is that if you look at the ASEAN Comprehensive Recovery Framework, it consists of 5 different broad strategies. And I think what is important to highlight here is that the need to enhance health system is very much linked in terms of how the region is able to maximize the potential of intra-ASEAN market integration in the region. And I think for me that basically shows how the region is trying to balance or manage the pandemic by linking the health sector with the economic stability in the region. So in other words, I think ASEAN, looking at the developments in the last 2 years, has recognized that since COVID-19 pandemic is both a health and economic crisis, managing both health and economy is therefore a critical or key to a successful recovery. For example, in the process of reopening our economies, I think since late of last year, the region also recognized, or governments in the region also recognized, that policy interventions need to be targeted as well as measured in order to make sure that whatever gains that are being realized from opening up the economies will not be compromised in case there are new cases of infections that may undermine the potential recovery. So let me talk about more of this ASEAN Comprehensive Recovery Framework by discussing the specific measures, both in the health and the economic sector, and how they contribute to the recovery in the post-pandemic world. If you can go to the next slide, please. This particular slide shows the different measures in terms of enhancing the health systems, as well as measures in terms of maximizing the potential of intra-ASEAN market. What I'm trying to show here is that there is indeed strong coordination between health and economic measures to sustain the recovery in ASEAN. For example, in terms of health measures such as strengthening the supply of essential services, or even the enhancing capacity of public health services, these health measures are actually being implemented through the support of the senior officials meeting on health and development. But at the same time, I think we need to highlight here that in the process of implementing these health measures, there is also greater consultation with the economic sector. For example, in terms of strengthening the supply of essential services, the health sector is coordinating with the coordinating committee on services in terms of how the ability to supply greater essential health services can further also support the integration of trade services in the region. Similarly, in terms of enhancing the capacity of public health services, there is also greater consultation with the other economic sector, like for example, the agriculture, to ensure that whatever measures being implemented on the health side would also impact on the economic side. I think another very good example of this coordination is in terms of the reopening of our tourism sector. If you look at what's happening in the region, the tourism sector is actually badly hit by this pandemic. I mean, around 75% of international tourism arrivals in the region have actually declined as a result of the pandemic. So as a result of that, the region has been trying to revive or reopen the tourism sector. And that requires not only the ability of the tourism sector to implement the much needed regulations for travel, but I think what is more important to highlight here as well is that the tourism sector is coordinating effectively with other sectors in the region, such as, for example, the health sector. How, for example, the health sector will be able to provide the necessary health protocols to ensure that the movement of people and services in the region is not only well facilitated, but as well as being safe across the region. So this is, I think, one thing unique about the ASEAN Comprehensive Recovery Framework. There is an increased recognition that the COVID-19 pandemic can only be mitigated if all the sectors in the region work together, from the health sector to the economic sector and to the other sectors in the region. Next slide, please. So what is the outlook here moving forward? I think the reality, again, if you look at what's happening in ASEAN right now, is that as COVID-19 persists, there's no doubt that the link between the health and economy will continue to remain crucial here. And as you can see in this slide, there are different factors that would impact on the economic performance of any country. And here, it's very obvious that the extent of disease suppression, as well as the implementation of containment strategies, would definitely be critical in terms of facilitating the recovery in the economic sector here. So meaning what I'm trying to say here, that the economic performance by countries in the region, I think, and also in ASEAN as well as other countries in the world, is going to be shaped by the extent by which countries are able to effectively contain the COVID-19 shock, and at the same time being able to implement other related measures. For example, according to the World Bank, one evidence suggests that countries that suffered high rates of COVID-19 and countries that relied more on prolonged restrictions on mobility were the ones with the weakest economic performance. And therefore, I think it's very obvious here that in terms of policy dimensions, what is needed for the region in ASEAN is to be able, first and foremost, to contain the pandemic, for example, through the implementation of effective vaccination program. At the same time, there is a need for a very strong fiscal policy to be able to support whatever activities of the government in terms of relief, recovery, as well as growth. And at the same, and more importantly, there is a need also for the region to build back better, meaning that In the process of implementing all these policies to support the post-pandemic recovery, it is not only the issue of containing the pandemic, but at the end of the day, after this pandemic, the region should be able to become more resilient as well as sustainable. I think one very good example of a collective response in the region is the vaccination program. So if you can go to the next slide, please. As you can see in this slide, again, we're saying here that vaccination is key to containing COVID-19 and facilitating the economic recovery in the region. Again, there is very strong evidence that increased immunity because of vaccination is going to lead to less disruptions in mobility and economic activity. And if you have that condition, it will definitely facilitate more economic activity or recovery in any countries or any region like in ASEAN. Again, one evidence provided by the World Bank here, as you can see from the slide, is that high frequency indicators of economic activity suggest that the recent economic activity is going to be relatively resilient to infections with high vaccination rates. What I'm saying here is that there is a very strong correlation between vaccination activity and economic growth, as according to this study by the World Bank, meaning that as the deployment of vaccination programs increases, the chances of greater economic growth are definitely also higher. At the same time, according to this evidence by the World Bank, greater vaccination activity would also lead to much improved economic situation of households, in a sense that higher vaccination activity would lead to a lower likelihood of unemployment in any country, as well as a lower likelihood of countries or households experiencing severe financial conditions. So definitely it is very obvious from this evidence here that accelerating deployment of vaccine in any countries, including in ASEAN, as well as the implementation of other health-related spending is definitely the first and the most important priority. So what is now the outlook for the ASEAN? So let me now go to the last slide here in terms of what seems to be the important priority for the region here. I think it is very clear here that COVID-19 has shown that both health and economic outcomes are highly interrelated, in a sense that any policy choices in one area, for example, in health, would have a corresponding impact on the way countries are able to recover better and sustain the growth momentum. But at the same time, I think we also recognize that the reality is that here is that countries still face a lot of challenges, particularly in terms of how they can manage the trade-offs, right, between economy and health. And definitely, I think it's not easy. It's very challenging. That's why I think moving forward, it is very important that countries are able to adapt a more dynamic view in terms of how to make the right policy choices in order to soften the trade-offs between health and economy. And one important strategy here is in terms of building or adopting the capacity for smart containment. And this includes the ability to test, trace, and isolate by implementing more targeted and less economically disrupted measures. For example, there is a very strong evidence that public testing can in fact reduce the number of infections by 10% per month. Similarly, there is a very strong evidence that suggests that the development of vaccines, as well as their efficient distribution, can indeed lead to greater social stability, as well as greater economic recovery moving forward. Finally, I think I just would like to highlight here that this COVID-19 pandemic, given the challenges that it imposed on every country, is definitely not very easy to deal with, as of course, as highlighted by the different country presentations earlier. That's why I think it is very important moving forward that the role of regional cooperation will play a very important role in order to ensure that regional measures are implemented to support whatever policy measures being implemented in each country. Because the way I look at it, COVID-19 pandemic is definitely a regional public bad. And therefore, any ability to address this public bad would involve not only interventions by countries, but more importantly, greater cooperation among countries in the region, like what's happening in ASEAN. So I think that's the end of my presentation, and I will look forward to your questions at the end. Thank you so much.
Thank you, Dr. Lilo, and thank you for the great insights and tips with regard to ASEAN member states' coordination and integration of health and economic measures under the pandemic. Covering both aspects, health and economy, is very challenging for all ASEAN member states, and choices are inseparably linked together as in trade-off relation, not just a policy or medical support, but having a strong regional partnership and government's dynamic views are the key points to build a better society after pandemic, I understand. Thank you, Dr. Lilo. We appreciate all wonderful presentations from key opinion leaders. We are moving to Q&A session from now. The time is around 15 minutes left. I'd like to pass this session to my colleague, Ms. Thalia. Please. Thank you, everyone.
Thank you, Nagatani-san. First of all, a very big thank you to Dr. Anton, Nagatani-san, and each of the panelists for an excellent discussion. I would also like to thank the participants for their very relevant and insightful questions. We have also taken note of the many questions that were sent in with the registrations. Since there were several broad themes addressed, your questions may not be individually addressed, but we hope you will hear the answer in one of the responses. Please post any additional questions in the Q&A box, also with the speaker's name. After this event, we will try to answer as many of them as possible via email within a few weeks. Without further ado, I will start the first question to Professor Prasit. Professor Prasit, in your expert opinion, how have vaccines and which vaccines have been safe and effective among the Thai population? Professor Prasit, please.
I think I have to say that all kinds of vaccines are safe as long as you have it on time, and as long as you have a booster dose. We start with the inactivated vaccine, the Sinovac, and then for the AstraZeneca vaccine, the viral vector vaccine, and right now we also have the messenger RNA vaccine. So it depends on the time of the vaccine. It is not the type of the vaccine that will be safe. Of course, if you look at the efficacy of the vaccine, you might look about the messenger RNA vaccine. But still, there's a group of people who are still aware of the long-term effect of messenger RNA, and they take the middle of the two kinds of vaccine, the inactivated vaccine and the messenger vaccine, that is the viral vector, the AstraZeneca one. So in Thailand, we confirm to the Thai people that all kinds of vaccines available in Thailand, they are safe.
Thank you, Professor Prasit, for those details. Now, on to the second question addressed to Yusek Verjere. At what point, if ever, would the Philippines possibly consider locking down international travel again? In terms of numbers and types of cases or other criteria? Yusek Verjere, the floor is yours.
Yes, thank you very much. As you all know, we have already opened up our borders since I think that was April, when we saw that our cases were being reduced already, and our case trends had been stabilized and sustained until this time. With regard to locking down the borders or closing the borders, we saw the experiences of other countries and also the experience of the Philippines, where we see that locking down or restricting incoming travelers or closing our borders is not really a sustainable strategy, both economically and also for the health of the Filipinos. That is why what we are doing right now is implementing the four-door strategy. This four-door strategy is a framework wherein we have different layers of restrictions or strategies so that we can safeguard the transmission or prevent transmission in the country. So right now, we have opened our borders, but we are still implementing doors 2, 3, and 4, meaning when individuals comes into or goes into their communities, there is already this safety protocol wherein they are being monitored. And also there is our strategies for detection and isolation. So this four-door strategy is already working for us right now. We do not believe that we can just close our borders, open it up, close it, open it up, like it's a back and forth activity, which really impacts on our economy. What we are doing right now is doing close surveillance. We are trying to enforce our safety protocols wherein we still have safeguards in our borders like pre-departure test and the checking if you are fully vaccinated or not. Those who are not vaccinated gets to be quarantined in our borders. We will be contemplating maybe the locking of our borders or closing of our borders in the future if and when variants comes in and will cause a spike in the number of cases again in the country. And we can also have that evidence wherein the variants are really having this community transmission already in the country. But for now, we like to stick with our four-door strategy. We have our alert level system wherein we have flags or we have these warning signals if and when the incoming travelers are causing infections in the country. And for now, cases are slowly plateauing and cases have not been spiking ever since we have opened our doors to travelers in the country.
Yusek Ferjere, thank you for your answer. We do also hope that another lockdown will not be necessary. Moving on to the next question to Professor Chandra. Professor, how can we make businesses more resilient against future health-related challenges like this pandemic? Have pandemic innovations proven fruitful and sustainable? Professor Chandra, please.
Okay, so thank you for the question. Basically, that is a kind of business question, not really a public health question. So I will not really give an answer, but I will give 5 comments or 5 explanations in this regard. My first comment or my first explanation, we all know that in the last more than 2 years, some of us are already working from home. Some our businesses are implemented virtually, and some businesses are working quite good. So we are something like used to work from home already, and some are working from the office. You know, we have a terminology of working from office, WFO. We have terminology of working from home, WFH. But now there is also terminology of working WFA, working from anywhere. So I think even though there is no more pandemic anymore, no pandemic anymore, we still can maintain some of our business activities by working from office or working from home or working from anywhere. That's my first comment. My second comment regarding the building, because usually business taking care of, perform in the offices building, I would like to mention about the architecture aspect of the building. You know, for COVID and for many diseases, it is transmitted via airborne. So the air ventilation of the building is become very important. So if we make a building or rearrange the architecture of the building, please taking care of the good ventilation for each of the office area in the building. The second aspect of architecture is regarding the touch-free. So, you know, during this COVID, we are trying to have some, not really technology, but we don't have to touch the knob of the door. We do not have to touch the button of the lift. This kind of thing, could and should be continued, even though after the pandemic is over. That's my second comment. My third comment is regarding the content. Of course, if people are working from office, we have to contact between each other, but there are still something that can be done. For instance, now in the lift or elevator, usually it is mentioned this lift can handle 10 or 11 people or 400 kilograms, or 500 kilograms, depending on the brand of the lift. But during COVID-19, we know one lift could only accommodate 5 or 6 people. I think that is good, because if it is too crowded in the lift, it's not only COVID, but it's not good for health. It's not good for hygiene as well. So maybe we can change the lift. Alarm will ring not because of kilogram, but if people already exceed 5 or 6, for instance. There's another issue of contact. You know, when people, there is a patient admitted in the ICU, usually the hospital would like to have the ICU clean, maybe not really sterile, but clean. But if visitor, family of the patient would like to visit him or her, so there is a digital, video, talking by video. I think that is still can be maintained even after COVID-19. That is the third aspect. The fourth explanation I would like to mention is I think it will have a big impact on business practices after pandemic is the cashless. So transaction money should not be by paper money, but cashless, and it has an overall impact will be healthy as well. And my last comment or my last explanation in this regard is regarding the industry 4.0 and 5.0. We know many businesses can be done. We'll use the 4.0 or 5.0 or digitalization. Artificial intelligence will have important place in businesses, robotic as well, or even augmented reality can play important role in our business after the pandemic. So those 5 explanations, that I gave, I think could be one of the way that we can have good business practices and healthy as well after the pandemic is over. Thank you.
Professor Chandra, thank you for your answer. It is very true that many businesses have innovated and transformed and even progressed well from the pandemic. Now we're moving on to Omagari Sensei. Omagari Sensei, how would you explain the recent rise of Omicron cases in Japan? And have there been innovation in Japan's approach against COVID-19 because of this wave? Omagari Sensei, please.
Well, yeah, you are right. The total number of the cases of COVID-19 because of the Omicron is quite high in the country, which is a reality. But at the same time, we learned that, the percentage of the people who requires hospitalization, and this is quite small at the same time. And now somehow the healthcare system has tolerated this, given this large number of the new cases. And now we know that, because the vaccination has some sort of the limitation, in other words, the vaccination cannot prevent us to catch infection, catch COVID-19 itself, although they can prevent the, the hospitalization or disease. Probably we have to change our mind, and which is also occurring in our country. So now we are thinking about, probably we have to accept significant number of the new cases with the COVID-19. Yeah, this is true. So that means that we have to think about, we have to make a social system that can tolerate it significantly large number of the patients with COVID-19. And to do that, we have to really make increase the capacity of the healthcare systems. But at the same time, by going through the big wave because of Omicron, now we somehow know that probably we can go through the next wave if the next wave is not so large. If the next wave is not much larger than the wave that we have just gone through. So probably we have to we were thinking about relaxing the infection prevention control measures slightly to increase the our activity, to raise the economic activity in our country. But at the same time, we have to probably take quite to the point measures of the infection prevention control to minimize our activity, like going out or something like that. So but by doing that, probably we can contain, or we will be able to decrease the total number of the new cases on the given one wave at the same time. And that means that probably we can decrease the total number of the cases which really requires admission or deaths, or who can suffer from the death by the COVID-19. So by doing that, probably we can keep the economic activity, and also we can maintain the usual activity of healthcare system as well. And if we can we can run the both sides together, probably we can, like I say, we can go through tolerate the next wave of the COVID-19.
Omagari-sensei, thank you for your answer. We can see that Japan's Omicron cases are going down already. And now moving on to Dr. Vijay. Dr. Vijay, does India accept a post-COVID-19 infection medical certificate as valid in place of vaccination? For example, for local and international travel. Dr. Vijay, the floor is yours.
Thanks, ma'am. Currently, India does not accept the post-COVID infection medical certificate in the place of vaccination certificate, because the development of immunity or duration of the production of COVID-19 exposure is not yet established and not yet determined. Therefore, Ministry of Health of India recommends to receive vaccine even after COVID-19 infection. Persons having laboratory test proven SARS-CoV-2 illness should defer the COVID-19 vaccination till 12 weeks after recovery. Individuals who have recovered at least the first dose and developed SARS-CoV infection before completion of the dose schedule should wait for 12 weeks after clinical recovery from the COVID illness. These are all the guidelines which we have now employing. Thanks for your questions. Thank you, ma'am.
Thank you, Dr. Vijay, for your explanation. Last but not least, we would like to ask Dr. Aladdin Rio. Dr. Aladdin, you mentioned about the need to balance health and economy in ASEAN, as exemplified by the ASEAN Comprehensive Recovery Framework. How can we ensure this result? Is there a regional mechanism to achieve it? Dr. Aladdin, please.
Yeah, thank you for your questions. I think there are two modalities in terms of ensuring result on balancing economy and health under ASEAN. One mechanism is through the ASEAN Coordinating Committee in Public Health Emergencies. This is a regional body that is being established, I think 2 years ago, to be able to address all related issues with regards to the pandemic, from the political to economic to social. And this coordinating committee is meeting regularly to ensure that the different initiatives that have been implemented since 2020 are being sustained and are being implemented effectively. The second mechanism is through the monitoring of ASEAN Comprehensive Recovery Framework. Within the ASEAN Secretariat, there is an existing unit that was created last year to be able to ensure that the measures under the ACRF are not only being agreed by countries, but also to make sure that those measures are being implemented across different sectors in the economy or in society. As you know, there are around 180 measures under the ASEAN Comprehensive Recovery Framework. Therefore, the ability to monitor those measures is very critical. That's why moving forward, if we want to sustain the post-pandemic recovery, we have to make sure that a strong monitoring mechanism is in place. And that is what basically ASEAN is trying to do. Thank you.
Dr. Aladdin, thank you for your explanation. There are still so many questions, but unfortunately, due to time constraints, we have to end the session here. Dear respected panelists, once again, thank you so much for an excellent session. We are very grateful to hear your extensive knowledge and insights on this topic. Thank you from all of us. It is now my pleasure to introduce Dr. Takuma Kato, Director of Healthcare Unit of ERIA, to give the summary and closing remarks. Dr. Kato, the floor is yours.
Hello, everyone. I'm Takuma Kato. Thank you very much for joining us today. And I'd like to express my deepest gratitude to all the distinguished speakers for sharing your valuable experience today. All speakers will receive a certificate of appreciation from ERIA. And so, as everyone knows, COVID-19 has been the biggest challenge for all countries for more than 2 years. From today's webinar, I think it was clear that every country has tried to protect its people's health and economy from the pandemic by using all the resources it has. Many citizens have also cooperated with the governments, and as a result, many countries are gradually overcoming these difficulties. However, the current situation suggests that COVID-19 is unlikely to disappear, unfortunately. Also, if you remember 2009, we experienced the H1N1 flu pandemic, as we listened today. And before that, there was also the SARS outbreak in our regions. So I'm quite sure that we have to not only just overcome this pandemic, but also prepare for new infectious diseases, which will again pose a threat in the near future. So at individual and community and government levels. So particularly at the government levels, we need to consider how to maintain and further improve the standards of public health and healthcare systems, which have been developed during this pandemic. So this time, I think that the resources that each country had were quite varied, which affects the measures taken in each country and their effectiveness. So I think today's webinar has been a good opportunity to compare best practices and consider what is lacking in each country from various aspects, such as law, human resources, healthcare industries, hospitals, public relations, IT systems, and so on. So in order to support policymaking against the pandemic, ERIA Healthcare Unit conducted 2 surveys about the situation of elderly people under the COVID-19 pandemic in 2020 under the partnership with Indonesian government. The first report of this survey has already been published, and the second one will be published soon, hopefully. These reports imply how much older people had difficulties and how effective the government support was, such as cash assistance. We hope to continue such research to support ERIA member states. Unfortunately, the pandemic is not yet completely over. We still have a big challenge to make our society lives as usual with COVID-19. So I personally think developing and implementing a new policy or system is very exciting and sometimes quite easy, but de-escalating those policies is often very difficult. Today, we have some examples. They are making very good examples to de-escalate such policies. So it was very helpful for me. Particularly this time, some policies are implemented politically rather than science-based. It's not bad because we couldn't wait until science provides good evidence, and sometimes evidence doesn't suggest a policy itself. But anyway, we still need to work hard to mitigate the impact of COVID-19 to develop both our health and economy under difficult situations. I hope that today's webinar is useful and applicable to your work. So that is my brief comment of today's conference. To our guests and speakers and to our audience, thank you again for joining us today. As this is our first webinar, your comments and feedback are very, very important. Please scan the QR code on the screen to reach the survey page and download the certificate of attendance today. Or you can also move to the survey page if you just click End button on the right bottom corner of your Zoom application. Any comments and feedback are very much welcome. And I would also like to inform you that today's webinar will be uploaded to our YouTube channel in a couple of weeks. Also, our publications, including the survey for elderly people in Indonesia, are available on our website. Please visit our website and our YouTube channel if you're interested. So thank you very much. Please stay safe and let's work to make society resilient against pandemics. Have a wonderful day. Thank you.
Yay.